What you're about to see is not about drug overdoses. It is about the current issue we are facing here in regards to needles and drug paraphernalia being left all around the city. This film is in no ways meant to discriminate or belittle any person, organization, our city, and government officials. Why was this film made? It started with many messages sent to me via email and messenger asking me to do a story on this topic. People are frustrated, and I thought it would be time to do a story on the complexity of this issue. St. Thomas is not the only place this is happening, and it is everywhere. You can't just flick a light switch and it all be fixed. I call this the iceberg issue. What we see on the top is just the tip of the iceberg, and what lies underneath is just a mountain of various problems, from housing to mental health to drug addiction to homelessness, and the mountain continues to grow. I want to express a warning to the viewers that you may hear or see something in this video that may upset you, and to that I say viewer discretion is advised.
So it's August 15th at about 1:35 by the Bubble Bird right now. And we're just, walking in here to take a look and see. This is one of the major hot spots in St. Thomas currently. And it has been, I've been getting calls here for close to a year, and it's just been, and there's stuff here now. So we'll take a look. It's also down in through here. Like you got their masks, and doesn't look too bad. Oh, right here, you can see this, Phil. That could be something there. And then always through here. It's a great spot, and there's been some city workers that have said they want to do something about this area. If it's cementing this whole area in here, if it's boarding up either side of the walls. But if you can take a look up through here, people jump from the parking garage onto OK Tire's roof, and they jump on there and they excrement, they party, they sleep, they do all they want up there, and get across here and come down here. So countless amounts. You can probably see. I'll send Tony maybe 4 or 5 videos so you can take your pick as to what drug paraphernalia and the amount of needles and homelessness that has gone on in this area. And and the city says they're going to do something about it, but I'm the one picking up the drug paraphernalia and needles. And it's not just me. There's the Skyline employees that are continuously being called here. The residents that live above Grand Central, they're being called. Calling myself and calling whoever they can. There's different people that do pick up needles, but I would say that I'm the most well known. At the end of the day.
So Brad, I just want to ask a question.
Yeah.
Just yesterday on Facebook,
Yep.
was the amount of new needles still sealed that were just like, it looked like hundreds of them that were left. This is where it was in this spot, was it? Okay.
Well, we're going to talk about downtown St. Thomas and some of the issues that are facing St. Thomas. We're hearing a lot about sharps, about litter, about our homeless, and the other things that happen in cities of our size. And I wanted to share with you some of the things that are really working on it. My point is that the summer of 2020 is really no different than the summer of 2019 or the one before. We have just gone through the COVID-19 pandemic, continue to be in it, which maybe has left the streets a little emptier, which shows the homeless a little bit more. But with the shelter open this year, and it wasn't last year, we've actually removed more people from the streets, or helped people find at least temporary housing from our streets this year. Do we have issues? Sure we do. We still need a lot of cleanup. We still need a lot of things to do, which is why we've instituted like the clean team from the DDB, which wasn't going this summer because there was a pandemic. And we said, look, we just can't go a summer where we're not out every morning picking up litter. We've added to that now also some help through with Brad and the neighborhood needle network, also helping with sharps in the downtown area. So we think we're, as a city, putting the right pressure on it. The insight we have is that the health unit is responsible for the distribution of harm reduction products. In this case, needles and sharps and other things to intravenous drug users. And we think that their distribution methods are extremely efficient. There's just too much on the street. That's really the issue. For the last year and a half as mayor, I've been working with them to try and come up with a solution to close the circle. We've got great distribution methods. That's not our issue. Our issue is that we're not getting it picked up, that it's not being returned. We have full needle bins and such downtown, so a great deal of it is being returned, but not all of it is. As you would know, there are people who would have a Tim Hortons cup in their hand and try and find a trash can and put it in it. There'll be people with a Tim Hortons cup in their hand and not find and just throw it on the ground. There are people who just don't have the same sense of community, and so it happens among all of these, all people. And so we find, even sharps strewn within meters of the disposal bins. And so it will take a team to pick them up. Well, this is what we've done. The health unit, which I also sit on, the health board, has come up with a future-looking idea of how to best get into the city of St. Thomas, using the city of St. Thomas as a pilot project, and not only do distribution from a harm reduction point of view, but to put a team together that will every day do cleanup. And we think that's the right method. Is that happening tomorrow? No, which is why we've gone together with the Downtown Development Board and put together the clean team, helping fund the clean team, including the needle pickup part of it, for the next little while the rest of it gets up and rolling. Look, this isn't without cost. The city of St. Thomas is spending about $100,000 a year right now on sharps retrieval, because they shouldn't be left on our street. We know we need to do that, so we do it. We've gone to the health board and said, this is your cost, not ours. We need you to help us with this. So we think working cooperatively with them and coming up with it will make that happen. We'll make a far better and safer St. Thomas.
I've grown up in Sparta and Elgin County, and I've lived here for the last 49 years. We have seen lots of changes, lots of ups and downs and flows, but what we're hearing in St. Thomas and Elgin County is something that we're seeing across this country. We're seeing it, in places like St. John, New Brunswick, and we talk about Vancouver. That's a real epicenter of this epidemic. But Fort McMurray, it is across the country. And so when we're looking at this, we look a lot of times of what can we do at a national level. And when I talk about fentanyl, 5 years ago, or back in 2015, when I had joined and went to Parliament for the first time, they talked a lot about fentanyl. And I had no idea what it was, but it was something that was already hitting the streets of Vancouver, and we were seeing all of these deaths. We continue to see all of these deaths. Now, the one thing with federal legislation and with federal funding is that there's so many different philosophies on how we should be dealing with this epidemic. And so some people will say that decriminalization will take part of it. Some people will talk about most social workers. We see the defund the police. We see a variety of different things like that. I think what we need to do is, there's bits and pieces from this whole idea, but the greatest thing we need to do right now is exactly what you're doing, which is bringing awareness so that we can have these conversations. There is such a stigma behind it, and that includes for individuals, for families, for the entire community. Communities get names for things that are happening everywhere. And I think what we need to do is we need to see what is the best way and what are some of the best policies, and how can we help end this epidemic, not just prolong it. I support the idea of what a safe injection site could be, But I think it needs all of the wraparound services that go with that include the counseling and addictions counseling, the mental health side of it. There needs to be those types of things as well. And you know, for me, it's the community. This is our own backyard. We should be proud of where we live, and I am continue to be proud of where I live. And we have so many great people, but you know, this is impacting lots and lots of families that we're seeing, and how can we work together as a community to eradicate this issue? So this is not just an issue here in St. Thomas, it is a nationwide issue.
The biggest response that I get from people is the handing out of the sharps material. So maybe that's somewhere that we can start. Does the federal government realize that sometimes the programs of handing out the stuff is not, I don't want to say not, well, I guess it's not being done properly.
Well,
I don't know what.
It's interesting that we talk about that, because I remember we had a discussion about this 2 years ago in Parliament, and we were talking about the Sharps Exchange, the exchange program taking place in federal penitentiaries. And I just remember going, why are we allowing drugs in penitentiaries in the first place? So, you know, it goes back to all of these different things, but there is the idea of personal responsibility, and something I'm very, very much supportive of, that we're giving out free needles, but they should also be taking them back. That we just can't look at people who have addictions. There needs to be responsibility as well, and making sure that the community is safe is really paramount. I have grandchildren, I have parents, we all have people that we love around these communities, and we want to make sure our playgrounds are safe. We're seeing needles and paraphernalia in all parts of the city, not just one select part, but all over the city. It is in our backyard, and we need to do more about it.
So with you being on the federal side, we have Jeff Urick for our member of Provincial Parliament, Joe Preston as our mayor. So I would assume that all three of you have been talking about this issue
We
too,
talk
right?
about these things all the time. I mean, we have a very, very great relationship, the three of us as individuals, and we can have those really straightforward personal conversations. So yes, we talk about it all the time. What are some things that we can be doing? What are some of the challenges? But we also, I mean, I look at every community. It's really up to the community as well. You know, how do they want to look at these types of things, and what would they like to see? Like you said, we'll hear a lot of "not in my backyard." Those types of things happen a lot as well, and we saw that on some of the choices of where London was putting some of their safe injection sites and some of their different shelters. There's lots of conversations like that are going on as well. But where do we want to see ourselves? And I think that's a lot of times is, where do you want to see yourself in 5 years? Where do you want to see yourself in 10 years? And any of these things that we're putting forward, what are the ramifications? What are the pros? What are the cons? And what is the best balanced approach for any of these things dealing with this drug epidemic? I think that we need to look at all different scenarios and pick some of the best pieces from each and every one that we can put together as a really strong policy for our own communities.
I'm president of the Nameless, and we are a grassroots harm reduction organization focusing on peer support and harm reduction. Basically what we do is we go out in community. During pre-COVID, we were solely an outreach team. Currently, right now, we run a table, and we have outreach 3 times a week in backpacks out in the community. We provide harm reduction, like sterile supplies, naloxone, disposal bins, clothing, food, peer support, and access to or suggested services to seek out should the individual bring that up as a need. We've been in community for about 1.5 years now, creating relationships from the ground up based in trust, dignity, and mutual respect. So that's kind of what we do. We provide community engagement sessions or information to the general public regarding sharp safety, how to properly dispose, what substances are, how that's, impacting our community, what can be done about it, and a lot of drug user advocacy, if you will. Basically, what we've been seeing in community is the struggle with accessibility. Not only in a general sense, because our city has limited resources, but with COVID-19, it has increased the barriers tenfold for the people that we do serve. The programs have restricted attendance or admittance. Services have slowed or completely shut down. Some services have move to a different platform, which is not accessible to many or any at all. Accessibility to those programs and services is massive. There are even internal program barriers that don't allow folks to meet the requirements to get that service. There is no detox in our city. There is no treatment facilities. As well, financial barriers that people do have with the limited amount of income that they do have. It doesn't support getting well, getting ahead, doing better. What else? What we've been hearing? What we've been hearing is that people want access to supports and services that are tailored to their needs and have their best interests in the forefront. We need to have an introduction, and we need to have a large amount of services having low barrier supports, meaning you don't have to fit a certain criteria to use those supports. Anybody can use them. That increases the amount of accessibility on the services part. We need to have access to a safe injection site. We need to increase the amount of bins, and we need to have a sense of community. That's what the folks are asking for. They come to us not because we only have sterile supplies, but we've created a family and a sense of belonging to these individuals that we serve. At our table or on outreach, we often hear words of kindness and welcoming, asking for things for others. Hey, I know that so-and-so is down the street and they're sleeping, so can I get this, and this for them? They take care of each other. They make sure that others have things who aren't prioritized in the service industry. We get questions all the time like, why is this person saying these things online? That's not very accurate. That's not very supportive. That's completely wrong. So a lot of misinformation is being spread, and fear-based tactics are very prominent in our community, and it's a lot that needs to be undone and unlearned from the community standpoint. We also need to have community engagement. Again, a sense of belonging, a sense of safety within a community is important for every person to thrive at the basic level.
So, little synopsis here. 2017, I come off the road truck driving. Open up Buff and Shine for the Cook family. And we were looking after the Log Cook Service Center, 93 years in business, cutting the grass, garbages, car wash, self-serve bays, and run a business. So between 2017 and the present, now that I own the business and moved to the front, there's a common thing that keeps going this way, and that's drug paraphernalia. It's like your little dirty secret in the room, the elephant in the room, no one wants to talk about it, but it's for real. I've probably seen on this property over 100 needles, easy. It's so common now, when I go by and see it, I grab gloves and pick it up and I dispose of it. It's not like, whoa, look at the needles. It's like cigarette butts now, eh? Fling one of those, do one of those. It's gross. So I was doing a podcast, and we still are, with Malachi. And I'm going to jump around here a little bit. Jonesy come on our podcast, and he's doing a service for the city, but my true opinion, if the health unit is going to give it away, give them to you for free, and I get the disease factor and all that stuff that goes with it, because they give you absolutely everything there. If you have any kind of vice, from sexual to drugs, intravenous, anything, whatever's your preference, they'll help you out. I get it. But there's got to be some kind of system here, and this is my belief. Just like my grandpa with fentanyl, you got to put them on the sheet, take it back, you get your prescription. They'll give you as many needles as you want. That was in there personally. They'll give you everything you need to cook it, the water, the syringes, the wipes. Guess where it all goes, people? Not all of it. Just discard it in public areas or private property, you name it. I see it on the Log Cook Service Center on a weekly basis. It's Crossroads in St. Thomas. So I get the one area that we've got to try to help disease infection. What's the difference when the problem with the fentanyl drug users that they had to button down on it? to bring them back because people were selling them. Well, we're not selling needles here, people, right? To me, this is pretty simple. 98% of us common folk in St. Thomas understand this. Certain organizations think you're just rude. I get racist, I get whatever. No, if you're going to get something for free, you return what you're going to. If you're going to do illegal drugs, how about this? If you're going to do illegal drugs, and you're going to get government-funded paraphernalia to help inject it, or however, smoking it, whatever you're doing, there should be a return policy. Common sense, because city workers don't want to pick them up, the police don't want to pick them up, no one wants to pick them up. Certain organizations are. I don't need to name them all, I don't need to get in their battles, but it's just, there's something wrong here. Do it with fentanyl and other opiates, but all of a sudden needles are just like cigarette butts. I just don't get it. Some of the areas here at the back of the Law Cook Service Center, there's a trailer for the Law Cook family, and then there's, I think, 2 or 3 trailers for the Railway Museum. So in between the trailers is a little hotbed of injection and misuse of stuff. There's in between the car wash and the mini storages is just a simple alleyway, and there's needles there. The best mini storage in the years that I've been here, there's a central door that you go through and go in. Well, all the people with these issues will tell other people to come in there, and they make it little party zones. And trust me, I've seen a few storage units that weren't used for storage units. It's pretty sad, and basically there's garbages out in front of the self-serve bays, and needles just right on top of the garbage. You take off the lid, and you're going to change it, and there it is. It's the shock factor's gone for me now, and it's sad. It's like cigarette butts. I keep beating on it too.
Are you ever afraid of getting poked?
No, I ain't afraid of, it's not like we're playing darts with them. They're just laying there. It's not like we're playing darts. I gotta be a real uneducated man to go grab that and go, hey, what's that? No. I grab some gloves, pick them up. I got latex nitrile gloves here that my employees use. It's pretty simple. Basically, sometimes just take a broom in a dustpan. It's pretty sad that our little village, and everyone says our little village is getting infected. It's been here for a long time. It's just getting a little bit worse. Perfect scenario that I think, because this isn't an overnight, 7-day, 1 year. This is a long time fix. Number one, I'm not into safe injection sites because that's all taxpayer driven. I'm going to give you a little side note stuff here. The Narcon thing, once, twice, you're out, stay out. That's taxpayer money. A lot of these guys are repeat offenders, people, all right? What I would like to see to fix, immediately start a return policy. If I needed needles, which I don't, if I need 10, name, number, address, here's 10. If I come back, whenever I'm done using, here's your 10, they dispose of them, here's 10 more. Immediately start that program. Second of all, the city works in the city department, in the mayor's office. I'm pretty sure you can fund someone, not naming names, just someone that's trained in doing it and walks the beat, has a central hotline, 8 hours pay, minimum wage, whatever. It's not we're breaking the bank here, people. Everyone's looking to pass the dollar. I see needles, oh no, call somebody. It ain't life or death. People pick up cigarette butts, pick up drug baggies, who knows what's been used for. I think there's a need for someone to be in that little bit of a crisis, just like the argument for a safe injection. There's argument for that. There's an argument for everything on this issue, but I think 98% of the human beings in St. Thomas would agree an exchange program, just simply throwing them away and no one wants to pick them up, because we had needles out back of the building. We call the cops, they don't want to pick them up. They'll tell you that. So then what's the next step? I think someone that 40 hours a week run like different organizations in town, and the organizations in town, my opinion only, shut your mouths. You're both doing something very good. You're making this issue look real bad. If you really look into it, people, and I ain't taking any sides, they're all doing good, but there's a better way to make this run.
Hi, my name is Steve Peters. I've lived downtown St. Thomas for over 28 years now. I've really enjoyed living here. It's given me the opportunity to walk to where I want to go, whether it's been work or out for dinner in the evenings. But I'd have to say an observation over the last 4 years, things have changed. Finding needle bits, drug paraphernalia, seeing a different group of individuals that are living out of backpacks, living out of shopping carts, and camping down at the north end of St. Catherine Street, and it's been different. And I've not had really any issues with the individuals, but it has changed, and I really would blame it on the new drugs that are out there on the street and what people are using. I certainly have nothing but great praise for the police. The police are driving through the neighborhood regularly. They keep on top of what's going on. The city has done its part to clean things up when called upon. There's other individuals in the community that have been out and about that are always willing to pick up drug paraphernalia. But the last 4 years, it's different. Do I feel safe in the downtown core? I feel safe, but I'm more guarded. I'm watching what's going on. I'm listening what's going on, and certainly keeping close tabs on what's happening in my neighborhood, because quite honestly, nobody's going to chase me out of living here. I've been here for too long, and I'm not going anywhere. But at the same time, I will, with my eyes and my ears, keep close observations as to what's going on, and make sure that the right people are aware of what's going on. I'd say as well, another observation is landlords need to play a stronger role in who they rent to and maintaining their properties. I've got some properties around me with landlords that are on top of their tenants regularly, and there's nothing going on in the house. Others, they frankly don't care. They're letting their asset deteriorate, and they really don't worry about anything other than making sure that they get the rent. So I think that there's a role that landlords need to play into helping turn things around too.
What I kind of want to know as a resident here, what would you like to see would be your perfect scenario that would help, not just like the people that are out here on the street cleaning up paraphernalia. If St. Thomas could be a leader in other communities, how do you think would be a nice scenario? Now, are we talking about safe injection sites, housing, getting treatment facilities, maybe more accountability on needle exchanges, or accountability on if you get 10 needles given to you, you need to bring back 10 needles before you get another whole bunch? For you, what would it be?
Well, I think first and foremost, I think we need to know what the issues are facing the individuals. We need to know what those individual needs are. There's a lot of really good supports that are out there in the community, and we need to understand why these individuals are choosing not to use them and live the life that they are living. Housing is certainly an important part of it. I'd rather see us find ways to deal with more in the way of harm reduction, and perhaps that is a safe injection site. It's better accountability when it comes to the distribution of needles and the other related paraphernalia that is going on. We need the supports. We need the mental health supports in the community. We need the rehab supports in the community. I think there's a lot of gaps that are out there. There's a lot of good individuals that are out there doing wonderful things, but it's like a really complicated jigsaw puzzle, and we've got all the pieces and they're all messed up right now, and we just need to find the right way to put it all together.
Well, I'm not sure that it's worse than any other summer, maybe a bit, but summer's like this. Summer is freedom, summer is drugs, summer is booze, summer is lying around and sleeping at night because you won't freeze. Summer is just more relaxed for everybody, and then it comes into fall and all of this changes and it gets tougher, and then people are really serious about finding some place and maybe behaving better. And you know, we do have drugs in this town, but I honestly, from what I'm seeing here, there are some serious people with serious problems, but I don't think it's a lot worse than other years. I think there's a lot more needles around, but there's other reasons for that. And you know, they're sweet people anyway. Even if, you know, drugs make them crazy, they're still sweet. When they come down, they're just, we love them. We like to look after them.
Have any of your clients ever expressed their feelings on what they would have wished the city would have had or implemented that they felt would be their kind of their savior?
I notice that our people don't have a sense of future. They're just scratching away, trying to get through the day, trying to get through the night, maybe the week. They are not forward thinkers. Some of the women would like to have a room of their own, but it's complex because they have boyfriends that use or they use, and then everybody gets kicked out and they're sadder than they were before. It's not a pretty story, and drugs are the devil. Some places want to, you know, look into the future and look after the children, and they should, but that's really not us. We just want to keep them alive a little bit. In a perfect world, you know, we would like to see no drugs and everybody healthy and happy. Well, it's not a perfect world, and it's not going to be. And part of that is that using makes you crazy. It does. And we're just hoping to keep everybody alive a bit longer and healthy if possible and cared for and loved. And we express this every day. We now have a lot of friends here. Some people have been coming here for 5 years. We've been going 6, and I think probably some have been around 6 too. Some of them say to us, you know, we wouldn't be alive if it wasn't for you. Well, I think that's an overstatement, but we certainly do our best to help. And I think that's about it. We're here to do whatever we can. We're dependable. They know we're going to be here. They know that even if they have misbehaved, we can talk about it. We can work together on it, and just don't want the F word.
So Jeff, can you tell me a little bit about on the provincial side of things? I know with you being a minister, you're still our local MPP for London, Elgin, Middlesex. Have you had talks with our Mayor, Joe Preston, and our MP, Karen Vecchio, even with the Southwestern Public Health? Have you guys all been chatting together or any meetings that you can kind of fill us in on this needles and drug paraphernalia that's been left around the city?
Well, certainly. I've had conversations with Mayor Preston, and I'm in constant contact with Karen Vecchio regarding many issues, but of course the issues of needles and drug paraphernalia has been a conversational piece numerous times. You know, I brought to them what the province has initiated this past March 3rd. We brought forth a roadmap to wellness, a plan to build Ontario's mental health and addiction system. So that's going to be coordinating addiction agencies, primary care, acute care, and comprehensive and connected provincial care, so that there's no gaps in the system. And that's what they're moving towards. We're putting $174 million in a year to build up the mental health and addiction sector of the province. And we've created the Mental Health and Addiction Center of Excellence, which will be coordinating the system in the province. So brought that forward, and I do know the Southwest Public Health does have a needle exchange program for folks to use, but obviously the issue is the needles are being left throughout our area.
So are you hearing some of the, even from your constituents, is it the issue of how many needles are being handed out and no accountability for them coming back? Is that one of the main issues, or is it maybe the mental health side of it, or is it a housing issue that I know another issue was brought up about safe injection sites, and other people are saying no, that's not technically the answer, because it still doesn't, they may be able to bring their needles and stuff there, but they necessarily may not leave their needles and everything there. and people are worried because that's a public funded operation. So, what is kind of the issue that you're hearing? I mean, on top of all locally here, is it more of a handing out that we need to do better on the accountability of where these needles are going?
Well, I think there's a combination. Obviously, we need to have a better support with those with mental health and addictions in Elgin, Middlesex, London, and hopefully the new program our government's putting forward and the money going into it will help address those. We were the first government with the Minister of Mental Health and Addictions, Michael Tabolo, who was also part of the program. But I think a lot that I'm hearing from my constituency office is following up what happens to those needles once they are given out to ensure they're cleaned up. And that's been a growing issue. And I know through my ministry, Ministry of Environment, Conservation and Parks, we've been revamping the recycling program and throughout the province. And I know one of the issues that we will be consulting on in the upcoming future is how do we properly ensure that sharps, drug paraphernalia are properly collected and not really recycled, but ensured they're stored safely out of our communities once they've been used. And that consultation will be coming forward, so we'll discuss that issue with municipalities, people in their communities, and also the producers of those sharps, those needles. They're going to have a responsibility to ensure that they end up in the proper storage at the end of their use, and definitely education will be key in making that go forward. But I look forward to that consultation probably later this fall or the new year to see how the province can lead charge in making sure that the producers of those wastes are held responsible and clean up our communities.
Now, one of the main emails that I received, so many comments relating to this one thing I'm going to read you here. Many people want to know this, and I'm wondering if maybe we can clear this up a little bit, Jeff, on the complexity of what this is and couldn't be, whichever. But it was, why can't we reopen part of the old psych hospital out on Sunset? Or our local hospital has many areas that have been closed down for a long time. And is there, can we reopen those? Get some services in there, possible treatment facilities. Has that even been brought to light, or is it even possible?
Well, that's what the whole idea that our work plan came forward with building a mental health and addiction system in this province. The plan is going to focus on improving quality, expanding services, implementing innovative solutions, and improving access to care. And under Minister Tabolo, that'll come forward. So ideas that are out there that want to come forward, specific or the Middlesex, London, want to hear about, so I bring them to the minister as solutions to help those with mental health and addictions. Now, whether it be reopening the old St. Thomas Psychiatric Hospital, which is currently up for sale. It's been empty for quite a while and needed quite a bit of influx of money. I don't know if it'd be workable or not, but those type of ideas need to come forward so they can be evaluated at the Ministry of Mental Health and Addictions and see if that's a way forward or if there's another solution out there. I know there's many groups out there, nonprofit organizations, the volunteer organizations that might have a solution and may need some funding to get started. But what we do need to focus on is support for those suffering from lack of support for mental health and addictions, and ensuring that the $174 million a year the government is spending to build up the system reaches areas like Elgin, Middlesex, London, and that's my role. But I need those ideas coming forward so I could feed them up to the right area and see if they can create some sort of new system into our area.
So would it be fair then, anybody that has ideas or recommendations, would it be fair that should they contact local government and then your office and then maybe even Karen's office just to pass the ideas on? Is that how people would get the ideas to you?
Well, definitely. If you want to bring forth an idea, and I think the solution that you've mentioned, I think the theme of yours is it's all levels of government that's going to be part of the solution. So it's going to be federal, provincial, and municipal. But I think if you have an idea, to make sure that you let every level know because each jurisdiction is doing their own thing to try to help solve the issue of needles in our communities, but also find supports for those with mental health and addictions that aren't receiving it right now. So definitely make sure you copy each level of government. That's Karen, Joe, and I for St. Thomas, and Elgin County, each municipality letting their mayors know as well, so that we can work together, but also we can let those that we work with, myself, Ministry of Health, Minister of Mental Health and Addictions, know about these ideas that we need for support in our communities.
But currently we have our daytime drop-in center at 423, the old community services building, the old Ontario Works building. And so that neighborhood needs to get special attention, more special effort. Last year it was as much down at PSNE, down by the east end of town. So yes, it moves around a bit. Look, we all know we need a far greater emphasis on community mental health services, on community addiction services. And our police have already put in place 2 officers on the MOST team that are community Canadian mental health workers. These are all great steps, but communities like ours don't have a health care component. We are not responsible for health care. We're responsible for a lot of other things. The water has to turn on, the garbage has to be picked up. And so we're working together with those that supply those services, Canadian Mental Health, Addictions Ontario, the ACT team, the St. Thomas Elgin General Hospital, which is really not a part of the city, but we work together with them and their psychiatric services, our police services for sure, to try and come up with a community effort that fits what the issue is we're now having. Where we currently stand, we're not, we have fantastic people doing fantastic work that isn't hitting the issue, that isn't finding the mental health cases on the street, people with mental health issues or addiction issues. And we need the more on the street level work with that. So we're putting together, along with the cleanup side to make the visual so much better, we want to work on the mental health side, the self-help side, the addiction prevention side also. So working with Minister Urick, and of course, look, we've got fantastic member of Provincial Parliament in Jeff Urick and a fantastic member of Federal Parliament in Karen Vecchio, and they're very helpful with what St. Thomas wants to do too. Well, all of the things we're talking on a treatment side are provincially funded. I mean, healthcare is a provincial issue, not a municipal issue. As Chris Herridge said last week, and took a bunch of hits for it from the keyboard warriors. Healthcare isn't a policing issue. I mean, it truly isn't. But who's the first one you call when somebody's acting out? Is the police. And so we've put mental health care in as part of that, addiction in as part of our police force. But the citizens of St. Thomas shouldn't be paying that as part of policing. That should be part of the provincial healthcare issue. And so that's why we're involving Minister Urick in a discussion about how to better spend the healthcare dollars, certainly in the mental health issue and in the Addictions Ontario issue here in St. Thomas. We know that that's how we will work it out. But I've been asked a lot, why don't you just, take over, such and such a building like the old psych hospital, or why don't you just take over and do this? Well, first of all, the psych hospital is not in St. Thomas; it's in Central Elgin, so it's not even in St. Thomas. It is not available. The province, we've asked for it. We attempted to use it for some other secure facilities during COVID-19, but it is just in that sad of shape. It currently doesn't have water or electricity or wastewater removal, so a lot of work would have to be done to it. But look, that's not mine to worry about. We have full capacity. We have In Out of the Cold as a shelter. We have a number of vacant congregate care units or boarding homes or rooms. Right? It's not that we can't house the homeless, right? We have capacity now in all of those facilities. What we don't have is the supports that go with housing those people. We have those people. I really hate that term, but we have to find the supportive issues, the Canadian mental health care workers, the the on-the-street workers that would help these people move into an apartment of their own or a room of their own or a shared accommodation of their own, and learn how to do that or work well with that. As I said, we have In Out of the Cold has been running at about half capacity all summer, and yet I hear nothing but complaints about the people on the street. Well, we can't arrest them and take them to In Out of the Cold. Some of them claim they don't want to be there. Okay, all right, and because there's rules. And well, we're not going to build a shelter without rules, and nor will I have a shelter that's at half capacity to build a second shelter so that will accommodate some people who don't like the first one. What's the only choice that comes from that? Building a third because they don't like the first two, and then building a fourth because they don't. Look, folks, we're offering good services, good meals, and good places to stay, so we want to continue to work on getting people to that capacity. Also, at that capacity, at In Out of the Cold, is where the services are available, where our navigators are, to help people with mental health issues, to help people with addiction issues, and to help people with housing issues. That's where to get it, right? So if you're already saying, I'm not going there, you're saying, I can't get help, I don't want it to happen. So from our community's point of view, we're really looking for, we've got to really beef up the volunteer piece to this. We've got to get our mental health situation, Canadian Mental Health Association and Addictions Ontario, all rowing the boat in the same direction, the ACT team and the hospital also. And we've got to get, as I said, we've already thrown the first gauntlet, if you will, on the cleanup. So we'll continue to make the downtown look better. I'm hoping that shares with St. Thomas what St. Thomas has been doing, what the city of St. Thomas has been trying to do to make this work. Well, on the sharp side, yes, and I've asked this question of both the health unit and other groups involved in the distribution of harm reduction. Are you tracking what you're giving out versus what you're getting back? Well, yes, in a relative way, they know what's distributed, but the return much comes through the city's bins and other collection methods. So there's not always a good matchup of what went out Tuesday, did it come back Wednesday? So we have to look at it more on a weekly and on a monthly basis. But what we really need, as I said, is that on the street presence of help workers that are also saying, and don't just throw that away, put that in the bins, let us help you with this, those types of actions also. But we started the first part where we're going to try and clean it up. The second part is how to keep it clean. What methods can we use to, if you will, reduce the amount we're seeing out there? You and I have both seen it where we've, here's a whole pile. Here's 40 or 50 sharps in a pile. Well, one person doesn't need 40 or 50 sharps in a day, and since they can be distributed each night, why are we giving somebody something in that amount? Why aren't we, and then just finding them later? Look, there's a lot of help being given in our community, whether it's through food. Ginny does a fantastic job down at Grace Cafe at helping with meals and communication and community standards. The PSNE does their bit. The In Out of the Cold does a fantastic job with all of that too. But collectively, we need to do a lot better job of organizing together as a community.
From the city side of it, regarding not just so much all the sharps that are left behind, but loitering and general other garbage, the city's doing what they can to work with that.
We've thrown resources at it now. Yes.
Owners of businesses and residential owners that also, maybe they rent their places out, whatever. Maybe they can step up a little bit to make their property cleaner and maybe more lighting so that it's
Certainly.
Not as welcoming to people to go and hide and shoot up and.
Yeah, well, look, and we would love everyone to be at one of our facilities rather than, look, a report from the police the other night, 2 or 3 different people sleeping in dumpsters. Now this is different than I can imagine when there is a shelter that is not at capacity. I don't understand why that might be the choice, but I don't understand is not a reason for us not to try and react. I don't understand is let's find out. Let's get people, let's ensure we know who people's names. Let's get to individuals and say, how can we help, right? You're right. Business owners can certainly help us with lighting and cleanliness in their own area. And as a business owner myself, that's of course job one. It's got to look perfect on the outside too. They get frustrated, of course, but we're in the downtown of a community, and this happens. The city itself is also involved with the DDB, the Downtown Development Board, and putting up some closed circuit cameras. So this will also help us from a policing point of view, but also help us from a safety point of view for people downtown and activities happening in the core. We'd like to do a lot more of that, and likely will in the future. But we've also done something maybe even more special here, and that's in the housing side. We've created, as I said, in out of the cold, it's not at capacity. We created the housing above the new social services building, 48 units there, with 48 more units going to go in behind there. We're working right now on the old transit building and making the upstairs micro apartments. So, you know, we keep saying housing first is the answer. If we can find somebody housed, first of all, they're not on the street littering. They would have their own apartment. But it also is a really good road to a much better future if we can continue as a city to work on the housing. Now, the opposite side of that, we've gone more than a decade previous, the city in the past, not building new market rent apartments. We just have a shortage of market rent apartments in our community. What's happening right now with the new building at the old Alma College site, and we have 2 or 3 more on the blocks now, ready to go. Other builders who are looking to build more housing in St. Thomas that isn't just houses. We're doing very well at the houses side, but we need rental apartment. Now, some of the new ones being built certainly aren't affordable, but it creates a supply so that the affordability of other apartments remains there, and we'll move forward. So that's part of our other plan, is not just to work on cleaning up, not just to work on sharps, not just to work on mental health, but to continue the whole path of housing from the shelter itself, which is the first step on the path to housing, all the way through, whether it's the new micro apartments or the geared to income apartments that the city can build. Cities can't supply all the housing that is needed, though. Private sector needs to step up and do their job too. We have a couple great builders who are starting to do that. Look, I'm proud of St. Thomas, and you know, somebody keeps, you know, somebody asked me, well, did you see this? And I went, yes, but it's still better than it was, and we're moving towards it. I can't expect. I've learned to not let perfection get in the way of good. You know, it's not perfect yet, but we're moving good. And when we see a problem, we pool our heads and our resources, like whether it was litter downtown or sharps downtown or housing, and just said, what's the today's solution for the future perfection? Let's start now, but move towards what will be perfect in the future. We'll continue to do that as a city and continue to look at it that way. I'm pretty proud of what we've been able to accomplish, certainly in the first 18 months of my term, but in this city over the last number of decades.
Get along down the road, we got a long, long way to go. Scared to live, scared to die. We ain't perfect, but we try. Get along while we can. Always give love the upper hand. Paint a wall, learn to dance. Call your mom, buy a boat, drink a beer, sing a song, make a friend. Can't we all get along?